Good morning, Elizabeth. How are you
Good
today?
morning. Hi, Fabi. I'm good. How are you?
I'm good. Thank you so much
Good.
for meeting with me. I was actually thinking of today's conversation, and so I just wanted to say, you've been with MHC for like 3 years now, or something
Yeah,
like
yeah,
that.
like three
And
and a half years, yeah.
yeah, and when you started, you had just gone out of grad school.
Yep, straight out
Yeah.
of grad school.
So I want to just kind of go and jump into it and just kind of tell us what is your title and what do you do for MHC?
Yeah, definitely. So I am a licensed therapist. I provide therapy for individuals, families, and couples over at Clinica del Alma. I work with all populations, but mostly the population we get at that location is the Latinx population, right? And this also includes undocumented immigrants, right? And then the cool thing too is that I get to provide services in Spanish, in my native language, as well as a lot of our population's native language. So it's pretty cool.
Yes, representation, that
Absolutely.
matters. Um, I want to get out of the way this question because sometimes I do just jump into it anyway. So I'm going to ask you, what are some of the challenges?
Yeah, definitely. So, some challenges that come up when providing services for this population, a lot of what I see is our clients are uninsured or underinsured. Therefore, it's a lot harder to be consistent with therapy and services in general, making it less effective, right? Sometimes they end up just closing their services, so that's tough. Another thing is also access to transportation. There's also things like judgment in the family that can also come up. Language barriers, definitely another one, right? In terms of serving this population, I'm lucky, right? Because I am bilingual and I get to provide those services. But yeah, these are some of the challenges we face when serving this population.
Got it. Yes. So definitely a lot, some things to take note of and to remember.
Absolutely.
Um, so what made you decide to do this work?
Yeah, that's a good one. So there's a few reasons, right? I knew that I always wanted to help others, right? I just wasn't sure to what capacity until I was in grad school. I lived in Colorado and I got to volunteer with a program that helped immigrants being released from detention. And so I realized that I could be that kind of beacon of hope or connection for this population that is being released. Um, Also, a little personal note, right, as well. My parents are immigrants. They came to this country many years ago in order to provide a better life for us and themselves, of course. And that's definitely something that I see with the immigrant population here. So anything that I can do to help, it's a great feeling.
Right, especially if you know like there's some commonality there and been in their shoes.
Exactly,
Yeah,
exactly.
awesome. So what are things that we should know about when working with this population?
Yeah, there's a lot. There's a lot, right? But it's important to understand. I think the biggest thing, the stigma that comes with seeking mental health services in the Latinx community. So there's a lot of judgment, making it difficult for this population to ask for help. Terms come up, right, like machismo and being labeled, quote, crazy. Those are obviously deterrents to seeking services. Another thing, Fabi, you mentioned earlier about representation, that's super important. There's not a lot of us as far as bilingual or multicultural providers, and I think that's really important for them to be able to see that, to see, wow, these people, these providers, they look like me, they hold similar values, they come from similar backgrounds and cultures. So I think that's really important.
Yes, absolutely. Ditto to all of that. Um, and I always think about this question myself, as being in this field for 10 years. But for you, what keeps you motivated?
Yes, definitely. So sometimes it's hard, right? We know that this kind of work is hard, but I think the number one thing for me is my clients, of course, just being able to provide that safe and non-judgmental space that they might otherwise not have in their community, within their family, all that stuff. So being able to provide that, I really it really keeps me going, right? Also being able to see their progress. They make progress and you're able to see it in front of you, and how they become more stable in their life, and become who they want to be someone who can give them the tools to adapt to a country where they may not know the culture or even the language, and to try to minimize the effect of acculturation. All of that stuff is significance, is of significance. So um, yeah, I think it's all it's something to definitely keep in mind when working with this population, and it just keeps me going. I really enjoy working with this population.
Yes, same, likewise. um, yeah, so much we could talk about, but just because we're keeping these short, thank you so, so much for your time and for, talking to us.
Yeah, definitely. I appreciate you asking me to help out. I'm always willing.